What's going on, everyone? I wanted to talk to you about a problem that I see in here all the time at the movement shop, which is low back pain. And so today we're going to talk about an exercise that I like to give to almost anyone who comes in here with low back pain to start to assess how their movement is and then to treat their back pain after we see how it's moving. And what we're going to do is called a hip hinge. And all you're going to need is a stick or a dowel here like this. You can use a golf club, a hockey stick, anything that's flat, and we can fit across the whole length of the back. So what we're going to do is we're going to have the stick here on the back like this and holding 3 points of contact. Your low back, your mid back, and then your head up top here. Once we have that position, we're going to see how far can you bend over while keeping those 3 points of contact with the stick on your back. Okay? Something that I see all the time with people who come in here with low back pain is they'll start out and they're pretty good, and then right about here they'll start to lose that position and then start rounding from their mid back. And one of the problems with that, if you don't have a strong back, is once you're here, it turns off these big strong muscles in the back, and it turns off your glutes and your hamstrings, so it puts them in a really poor position for them to do their job well. So you can see as I come down like that, if I keep the stick flat on my back, my hips go straight backwards, but as I lose that kind of a position, you can see my hips kind of tuck under and they rotate back under, and it puts in a really ineffective position for the glutes and the hamstrings and the low back. So once we have that position, we're going to do that a few times and make sure that you have a really strong position there. Then we're going to retest the same thing, but with a single leg toe touch. So now the stick's back on my back, and then I'm going to have all my weight through the left leg and then just a little bit of weight through the toes on my right foot. And we're going to go through the same pattern. Can I bend over and come back up, keeping the stick flat on my back while I barely have any weight on these back toes, and then coming back up. Do about 5 to 10 of those, and then we're going to do the other side. Same thing, barely any weight on this left leg now. I'm going to come down, okay, keep the stick flat on my back, come back up, 5 to 10 of those. And we're going to look for a couple different things. 1, can we keep the stick flat on our back from side to side? 2, does one hip and hamstring feel tighter versus the other side, one side to the other? And the third is, does it feel stable? So as I come down, does one hip feel stronger than the other hip as we're going through the hip hinge pattern? And so this is so important because as we hip hinge, right, now if I let go of the stick and I pick up this weight, right, I'm in the same position. So if we can get that hip hinge position down really well, then when we go to pick up something heavy off the floor, we don't have to worry about our back hurting because we just got it that much stronger in that good strong position. So give that one a try and let us know how it goes.